The Tobacco Products and Electronic Delivery Systems Bill, TPEDS, a bit of a complicated name, but it's the Tobacco Products and Electronic Delivery Systems Bill, presented to Parliament in May this year by the Department of Health. Has its supporters the National Council Against Smoking, Cancer Association of South Africa, the South African Medical Research Council, about easing the burden on South Africa's public health system because of the high frequency of smokers in South Africa. But there are many who say, well, this infringes not only on personal rights, but as lockdown has shown us, the South African government can do very sweet little to control the influx of illegal, illicit cigarettes, and regardless of whatever prohibition there is, smoking will continue. There are many who've called for the overall banning of smoking in public places. That is contained in the bill. 100% smoke-free indoor ban in certain outdoor places. The ban on sale of cigarettes through vending machines, banning the display of tobacco and also electronic delivery products. That's simply another word for vapes at the point of sale. But also changing the current textual warnings on tobacco products. Joining me today is Sharon Nyatanza of the National Council Against Smoking. Ivo Vegtor is a columnist writing an interesting piece on his sites, simply saying why the anti-smoking bill will backfire. And Kurt Yeo is of the advocacy group Vaping Saved My Life. Sharon, really appreciate your time. I'll start with you. South Africa does have an issue of smoking, and I must declare my interest that I am a smoker myself. I also can declare that I am largely troubled when people are smoking in my environment when I don't want them to be smoking. So I am, like to call myself, very conscious about this habit. But let's try and talk about this very fairly and squarely. What do you see is the importance of the Tobacco Products and Electronic Delivery Systems Bill currently before Parliament? Sharon, good morning.
Morning, Lester. Thanks for making time for this important conversation. So yes, the bill before Parliament, I know some of the key, highlights of the bill is the introduction of 100% smoke-free public indoor arears. And the aim there really is to protect the non-smoker. The aim there is to try and build and change social norms, around smoking. We get a lot of complaints at the National Council Against Smoking from people who stay, for example, in shared housings, people who work in restaurants or who visit restaurants sometimes, and they'll be complaining about, their violation of the right to health, their violation of their right to actually breathe clean air. And we get a lot of that. And current laws are not adequate in protecting, non-smokers. Studies which were done in University of Pretoria actually showed that even in the non-smoking sections of restaurants, there is high levels of smoke still. So that's one of the key aims of the bill. And another aim as well, you already mentioned that there will be a move from text-only health warnings to also picture-based warnings, what we call plain packaging. And that really has been the global move towards plain packaged packs. And the aim there is to have more education, draw attention more to the health warnings, and try to reduce the appeal of products. And it has been proven as well globally that this actually does have an effect in reducing initiation, in actually encouraging even smokers, hopefully, to quit. And obviously, there's been a lot of challenges around such measures, even globally, up until to the World Trade Organization. And I must state that nowhere in the world has that challenge been successful against plain packaging. For example, the courts have found that it's actually a reasonable curtailment of the rise of, let's say, tobacco industry to try and market the product. So these are all the highlights of the bill. Yes, we're trying to protect non-smokers. At the same time, we're trying to protect even the smokers as well. We'll see that. I think this is something that will be highlighted talked about.
We'll get into the personal health in a short while. But Ivo, I'll come to you. Writing on the Daily Friend, anti-smoker bill ignores science, will backfire. But Sharon makes a very important point. The beginning and the end of this bill, there are other caveats as well, but it's to protect the non-smoker from the smoker. As a smoker myself, I don't like it when I'm not smoking in particularly a public environment and someone lights up. Surely we express that we must all be conscientious, and sometimes if we need a legislative means to do that, that's absolutely reasonable, Ivo.
I entirely agree that government has a right to protect others from smokers. The question is whether this bill will actually do so. Right now, I want to talk at some point about the impact on the industry of all this prohibition of marketing of tobacco and so on, and the impact on smokers. But this is basically a prohibitionist strategy that the government is taking. They didn't learn from their catastrophic tobacco ban in 2020, which all it did was it turned the market share of illicit tobacco producers from 30% before the ban to 70% after the ban. Today, they still control as much as 70% of the total market for cigarettes. Right. So government has been unable to enforce existing regulations, right, that protect non-smokers. And in fact, smoking incidence in South Africa has been rising. Right, this anti-smoking strategy, the prohibitionist strategy, has been failing. Now, if you can't enforce the rules, then making the rules stricter won't help. Right, now, your guest said that nowhere has anti-smoking been successful. Anti-smoking regulation has been successful, but that is not true. And I can go into some more detail on this as well. But Sweden, for example, will become this year the first country to reach 5% smoking rate, right, which is by international standards considered smoke-free. Right. This is 17 years before the EU target date of 2040. Now, the reason it did so, the successful strategy it followed, was to embrace harm reduction as a strategy. Right. They introduced, they first popularized snus, the little packets that you keep in your mouth, smoke-free stuff, oral nicotine pouches, and then when vaping came around, they actively promoted vaping, right, as a quit smoking strategy. And this delivered sensational public health gains. Right? It has now a far lower smoking-related cancer statistics than the European average. It has been successful. It has reached, this year, smoke-free status. Public Health England is using the same strategy. Right? They're giving people vapes to stop them smoking. Right? And that's working. The science is there. There are strategies that are working. That it's not the prohibitionist, moralistic strategy that South Africa's following. Right. It's an enlightened, science-driven strategy that says, let's reduce harm. Let's give people options on how to quit smoking. That works.
Kurt Yeo, I'll bring you into the conversation. Co-founder of Vaping Saved My Life. Ivo reference an international example. I want to reference another one. Australia. They have decided to kick the vaping habit in enforcing very stringent regulations when it comes to vaping e-cigarettes, because it said that vaping and e-cigarettes was factually promoting and seeing an increase in recreational vaping, the consumption of a nicotine product through a device, through younger people. So you're seeing younger people who have never been before interested in smoking a nicotine tobacco cigarette, but through influencers have taken up vaping. Your response to that argument?
Well, in Australia, they introduced a prescription model in 2021, where any nicotine vape that was required would require a prescription model. Unfortunately, what we saw was the majority of the medical professionals out there were not providing these prescriptions, and that exploded the black market. And the black market is what is unbeholden to anybody. What Australia wants to do now is double down. And unfortunately, that black market has now introduced these products in informal sources. And we're hearing, alarmingly, the youth taking up these products. And once again, a very prohibitionist and restrictive policy that went against everything else that Alpha has just spoken about. Went to prescription model, doctors were not providing those prescriptions, and the black market just took hold.
Ivo, on the public health message, and we spoke earlier about protecting non-smokers from smoker. Does the state have the right to protect the smoker as well as the public health system? The UCT's research unit on accessible products says in 2016, the health and economic burden on South Africa when it comes to smoking and pulmonary diseases connected to smoking was something like 42 billion rand in 2016. They estimate that number has increased. Surely the state has the responsibility to say, we want to protect public health systems. We also want to protect a smoker, and therefore some intervention would be necessary because it is costing you and I, people who don't smoke, 42 billion rand a year.
It does. They did a study in America, though, right, which shows that, yes, although there are public health costs related to smoking, because obviously smokers get lung diseases and various other diseases that need to be treated. Smokers also have the good grace to die about 10 years before everyone else does, right? So those 10 years are generally the older years of their lives when they require pensions, they require social security, they require various other healthcare procedures because, your healthcare costs don't go down when you get older. So there's a whole lot of geriatric care that they save the government. And they actually did the numbers on it, and they worked out that smokers on average save the public health system money, So yes, there are costs involved, but there are also savings involved, and those savings exceed the costs of treating smoking-related illnesses, and that is never mentioned. That smokers kindly die at 60 instead of at 80, and that saves the government a whole lot of money. I want to address another point.
It also costs, and I give credit to people who work beyond and are still productive. Losing people earlier at an earlier rate is not necessarily a benefit to GDP, Ivo. In fact, we're losing productivity if people die earlier.
No, you're right, and they actually counted that in the I can draw up the article here. They did count the loss of productivity in the numbers, in the cost of smoking. They said it's 69 billion a year in direct healthcare costs and an additional 97 billion a year in lost productivity. And then they did the numbers, and they said smokers die some 10 years earlier than non-smokers, and those premature deaths provide a savings to Medicare, Social Security, private pensions, and other programs. So there's a net cost savings. For every pack of cigarettes smoked, the country reaps a net cost savings of 32 cents, said Vanderbilt University economist Kip Viscusi. Right, so they did the numbers. It works out that way. It might not work out exactly the same way in South Africa, but the idea that government needs to protect us from ourselves is problematic.
Sharon, to you, the same University of Cape Town's Accessible Products Unit says we may not need legislation, and that there has been a natural decrease in the number of smokers simply when we increase the tax, when we increase the excise on tobacco products. Do we necessarily need a black and white legislation when the UCST's Accessible Products Unit says simply make it more expensive and fewer people will smoke? Sharon?
Yes, so the RIP unit basically are economists, and we agree because we actually are partners, work with them. And one of the most effective ways to reduce consumption is taxation. But a key part of tobacco control is the need for comprehensive action. So it's not only the tax, but we also need the legislation because it actually helps in creating an environment where, for example, we're deterring the youth, we're reducing consumption. So definitely, yes, we also need the legislation. So working together, that's the whole aim of the law as well, to try and attack this from all angles, because we simply, for example, cannot be working on reducing advertising when, for example, we don't have the appropriate health warnings, when, for example, we don't have the right tax system. So all the little bits part of the policy, they have to work together for them to work effectively, most effectively.
Kurt, you're part of a broader sector that has been impacted by legislation, particularly around tax. For the first time, it was a month or so ago, that vaping products have become taxable in South Africa. What impact has that had, firstly, on the small businesses that have propped up over the last few years, and also on that increasing cost on people turning to vaping products?
Lester, it's had a massive impact because remember the majority of the e-liquids, local e-liquids that are manufactured are usually on larger containers. We're not the manufacturers of disposable products or the small units that we see at the retail outlets. We're the manufacturers, or South African manufacturers, of the large containers. And at R2.90 per mil, irrespective of the nicotine content, is effectively removing any opportunity for these small businesses to grow. In fact, I know of one company that's lost 14 locations and 48 staff members, purely based around this tax, because our local industries don't make the disposables. And unfortunately, it's the disposables that are the most attracted to the youth. It's not the locally produced 120 ml, 3 milligram nicotine products that are made in our small businesses. It's the imported products that would fetch a minimum of R5.80 tax on a disposable vape. It's absolutely ludicrous. The bill is literally designed to destroy the small vaping business and small vaping industry of South Africa.
Sharon, your response on what impact or research you have seen since vaping liquids have become accessible products in South Africa?
So basically what we're seeing right now, we don't have the science to talk about the effects. But one key thing that came from Cape Town, I think, is from Professor Van Zyl-Smit. He was doing a study on high school students in Cape Town, and he did see that, of those who vaped, 60% of them have to vape within the first hour, showing high addiction. So definitely we do have a problem. And for example, I think Kate already mentioned that even these disposables, they are very, very attractive to kids. And we see a lot of children starting to use, vaping. And the key part of the bill is trying to strike a balance between all these competing interests. Vapers can still buy, they can still vape, but we need to control how they are marketed, where they're sold, the ingredients, the labeling, etc. So we're trying to strike the balance, between allowing the adults to use, at the same time trying as much as possible to dissuade and prevent the child from starting, because when they do, they go on to continue to smoke even the combustible cigarettes. So, yes.
Ivo, you write in your piece, a fascinating piece, and make some very, very strong points. You argue whether a broad, wide-sweeping law could actually be enforced in South Africa, but you also talk very much about rights. Answer this question from a listener. Please ask your guest who is against the stricter laws, how he suggests non-smokers be protected from those who will decide never to stop smoking regardless. We cannot enjoy our living and recreational spaces because everyone believes in their rights. If I look at the Global Adult Tobacco Survey conducted by the SA Medical Research Council, it says there's a far majority of South Africans would prefer 9 out of 10 adults supporting a ban on smoking in indoor workplaces and public places, according to the SA Medical Research Council.
Yeah.
Ivo?
Very simple. In indoor workplaces, smoking should be banned. In most indoor other spaces, smoking should be banned. You and I walk into a shopping mall today, we're not going to be lighting up. Well, I quit smoking, using a vape, by the way. But we're not going to be lighting up in public places. There may be some restaurants and so on that have separated smoking areas where we would be allowed to smoke, but otherwise we wouldn't. We would go outside and smoke some. This is the whole point. The existing law already caters for that. Might be tightened here and there a little bit, but this is not what this bill is about. This bill goes much further than that. It's and I want to address a few things about vaping here, because there's a whole bunch of misinformation that's going around on vaping. One is that this is a problem with children. Well, if it's a problem with children, then ban it for children. It's as simple as that, right? The same way we do with alcohol, the same way we do with cigarettes. Do not sell under 18s. If an under 18 brings a vape to school, put them on detention, confiscate the vape. Simple as that. If parents buy vapes for children, give them a fine, or whatever. There's legislative ways to do that, to prohibit children from having these things. Saying that the fact that they're available on the market makes them available to children is nonsense. This is simply not how it works. They're just as available to children as cigarettes are. So we need to treat them the same way. The idea that vaping is a gateway drug to tobacco is also not true. Public Health England did the research on that. 0.5% of all vapers, right, were not previously smokers, right? So very, very few people take up vaping, right, if they haven't been smokers before, right? So the idea that they're a gateway to smokers, it's just not true. The same with health issues, health effects on vaping. There haven't been any confirmed health issues. There are one or two issues at the margins, but there are pretty much no health issues with vaping. So the idea that they're somehow dangerous is also absolute nonsense.
Kurt, I'll have you have 60 seconds to wrap up. Sharon, 60 seconds, and Ivo, 60 seconds. On where do you want this conversation to go? This bill is still out for oral submissions, for public comment, very, very far from being made legislation. Yet 60 seconds, Kurt Yeo.
I think where the bill is not based on any scientific evidence whatsoever. And I need to remind everybody here, South Africa hasn't done enough in terms of helping smokers. We don't have Article 14 fully implemented into South Africans' public health. We don't have cessation clinics. We don't have cessation support for our public. And the other thing is we don't have implemented Article 15 in terms of managing of the illicit trade. We have a smoking problem in this country. And the majority of the youth that use nicotine use combustible tobacco. That's 23.9% of the age of 15 to 24, but only 3% use vaping products. So I think we need to come back to the evidence and be very honest that we are not dealing with this correctly. And this bill is not going to do it.
29.4% of South Africans use some form of tobacco product, according to the SA Medical Research Council. Sharon, your last 60 seconds.
So I think for me, the highlight there is that the bill is trying to deal with competing interests. We need to try and protect non-smokers. We need to try and dissuade the youth from starting to smoke. We need to encourage as well smokers to quit smoking. And this bill strikes the perfect balance. The vapers, for example, can still vape. It does not ban vaping, this bill. You can still access the product. You can still use the product, but you need to do so in a manner reasonable, such that you don't violate the right of children. You don't violate the rights of non-smokers. And that is basically what this bill is doing.
Sharon, Kurt, Ivo, it's a conversation that needs to continue, and I hope we have more public engagements like that. Really appreciate it.